Welcome back to our C1 Table Talk. My name is Brianna Young, a certified community health worker here at CelebrateOne. We are so excited to be with you again today. These table talks are designed based off of your needs you express to us. So if you have a topic that you would like to hear us to discuss, or if you are in need of a community health worker, please contact us on any of our social media platforms, or you can call or text 614-570-3592. These talks will be held on the fourth Thursday of every month. We know our families are having a difficult time and feeling isolated, so we wanted to make it easy for you to stay in touch with us and to continue to provide resources for you and your babies. Don't hesitate to call or text us, and we will follow up as soon as possible. Please tag your friends and family, like and share our video. Be sure to share this information to the families in need that you know. Today, we're here to talk about mental health. But first, I would like to take a moment to say Happy Mother's Day to all of our mothers. Mental health is becoming more dynamic and has impacted many people, especially during these times. It's often difficult to talk about mental health, but it affects so many of us. So let's talk about it. Today we have Stacey Adams, a therapist from North Community Counseling Centers. Welcome, Stacey. Thank you so much for joining us today. We're excited to have this discussion. We hope this conversation will help our community lift the stigma attached to mental health. If you would, please introduce yourself and share with us some information about your organization.
Yes, thank you, Brianna, for having me. Again, my name is Stacey Adams with North Community Counseling Center, and I work with our Women's Empowerment Program. With North Community, we have a variety of programs within our organizations, from individual counseling to psychiatry to substance abuse use to case management. We also have our New Americans program with our Nepali Bhutanese program within our organization, and our Somali counseling and case management. North Community been around for several years, and we just love working with our people in our community and reaching out to our immigrants or refugees that come into our city here in Columbus.
That is awesome. We are so happy that an organization like yours exists. So how do we get connected?
Yes, for a connection, it's simply easy. We have an intake process, and you can just Google www.northcommunity.com. If you want to reach out to me, it's sadams@northcommunity.com. And also, you can call or text me at 614-639-0310.
So how many people live with some sort of mental health concerns? And is that number the same or different for women versus men?
In America, and this is through the NAMI reports, through the National Allowance on Mental Health, 1 in 5 people in a household suffer with mental health. A lot of people in diverse groups, meaningly men and women, do not recognize and do not how can I say, get help for their mental health. You will find it more in other populations with our Caucasians families who go out and seek help, or our LBGT groups who go out and seek help. But sincerely, in our African American and our Hispanic population, even the poly populations, you find that mental health is a stigma that is not addressed as much.
Yes. Is there a difference in the statistics for people of color compared to the people of other racial ethnic backgrounds?
Yes, with African American, you will find 17% of African American who seek counseling seek out help for mental health. In our Hispanic, there's only 18%. When you have multi-race or multicultural it's 32%. But with our Caucasians, it's about 60% who seek out. So there's a disparity in numbers who seek out for mental health.
So, what do you think that we could do to help eliminate the stigma associated with mental health?
One of the things that I find is what you guys are doing in Celebrate One, as well as North Community and other agencies within Columbus, Ohio, we are going out into the community, reaching out to people, having that one on one talk with them, building that rapport within our neighborhoods, reaching out to people. I think that's the biggest way we can decrease the stigma. Here at North Community, I forgot to mention, we also have a school-based team. So we are in the schools doing counseling with our children, which reaches our families with mental health in our communities. So that is a big thing, is building that rapport, engaging into your community, know who's your partners in your back door, and who can you collaborate with to make sure that the people are being heard and that they are being listened to. So when you having your community events, as we have our produce market first Fridays with our Nepali Bhutanese group, welcome to anybody in the community. We're reaching out, we're talking, we're getting people linked. And I think that one-on-one is very important to break those stigmas.
Yes, I completely agree with you. Being a community health worker, I can't agree more that, you just definitely need that, one-on-one. So, how do you encourage individuals to be more open and eventually get connected to support?
What I do in my women's empowerment group, I allow them to kind of listen into our group topics, and it becomes by word of mouth. And so I will share about the smallest things, what everyday American faces. If you're facing with stress or worry, that's how I frame it. I frame it in a way where it's not a stigma of mental health. It's a stigma of what do the average person deal with? Well, we deal with stress, we deal with and worry. And so framing it in different words, it gets them to listen in to say, you know what, I do have a substantial amount of worry that I need to address. How could you help me? What we deal with is seeking out the smallest things, whether it's financial barriers, giving them ways of how to budget and deal with that stress. Talking to them from that perspective gets them to listen. Because I feel like if you can't deal with what it's the Maslow hierarchy of needs. If you need bread, water, or your utilities is down, but if I help you get those things, then you're able to deal with the mental health.
I see, and I definitely agree. It's the way you word things. When a person receives mental health diagnosis, will they experience these symptoms forever or will they get better?
It depends on the diagnosis. When you're dealing with anxiety, I feel that I'm dealing with the symptoms of anxiety. I just get better coping with it. Sometimes I believe that it's genetic. So if there's a genetic system of my mom had, say, bipolar and bipolar depression, and then it comes down the line where I'm in a young adult dealing with these things. I can hit it off at the head and begin to address these problems, these symptoms. I never say I have anger, I have symptoms of anger. So I never label. There's ways that you can decrease your symptoms through therapy, through exercise, through working through the symptoms and acknowledging that, you know what, I have some depression. Maybe it's minimal, maybe it's large. What can I do to kind of work through it to decrease? So I don't say I can have it forever. I can do better at coping and healing from the process. Here at North Community, I run through a lot of women and men who have trauma. They have been experiencing things in their life. And so I never dealt with it, but dealing with when they begin to be receptive to dealing with those issues, then they're like, you know what? Now I can cope with it. This has been holding on for 12 years, It can be, say, Brianna, I moved from Columbus to Cleveland. My support group was here in Columbus. So I'm adjusting to a change. So I may have some anxiety. I may have some depression. So now let's deal with that change of me moving, and now I'll get better coping. And then all of a sudden, it's gone. I'm adjusted. So I won't keep this adjustment disorder stable forever. I'm adjusted now. I identified the problem and begin to work on it. Well, the symptoms.
Yes, that makes a lot of sense. So, how do I find the time to prioritize myself and my mental health when I already have so much going on?
One of my big things, my quote is, you can't serve from an empty vessel. So if you got so much down, there's so much on your plate. You can only consume so much. You need to scale things back. And you have to say, one of the things I teach about the women's empowerment group, self-care, self-compassion. Take those 2 minutes to enjoy your breakfast. Take that 5 minutes to sit down and just read a book or read a chapter in a book. Listen to music. There's times throughout the day that you can, how can you say, still away to reframe, reflect, just reflect on the things that you need, so you can be able to say, I can move to the next agenda. But if you keep running and running, there's a lot of avoidance of you're not, how can I say, refilling your vessel. It's empty. You're on gas. It's like driving a car without gas. You're gonna crash, and your body is gonna tell you, hey, I need you to take a break. Now that you're empty, are you gonna work on these things? So balancing is key to dealing with stress, dealing with mental health. You gotta take care of yourself. And that's priority, even with sleep. And it can be scaling back and saying, you know what, I haven't gotten any rest. Let's go to bed at 10 o'clock today instead of 12. you know it's called baby steps. Everything is not a quick, fast, easy as American habit. You have to take the process in those baby steps to get to where you need to be.
Yes, thank you. And lastly, can some mental health medications affect a person to breastfeed?
I'm not quite sure of that. My recommendation is talking to your doctor and expressing to them, how you're feeling. I believe a doctor not only just deal with the physical, should deal with the mental and the emotional. So I encourage my clients to have a list and going with the doctor, say, hey, I've been taking this medication and I'm not motivated, or maybe I'm not being able to breastfeed, or my milk is not producing. And so being an advocate for yourself and going and asking those questions surrounding your medication.
Yes. Well, Stacey, this has been such an amazing interview. You really gave some great advice and tips to our viewers. Thank you so much for taking the time to be here. And I know that I personally learned a lot. Can you share with the viewers one last time how to get connected with you?
Yes, through North Community, www.northcommunity.com. You can also reach me at Adams, Adams, at northcommunity.com. And also call or text. My number is 614-639-0310. And I am the program director over the Women's Empowerment program here at North Community.
Thank you so much for that. We really want our families to know that mental health services are covered under Medicaid, so you can potentially receive mental health support at no cost to you. Don't feel like you have to figure this out on your own. Call or text your community health worker today at 614-570-3592, and we can help you get connected to these services that fit your needs. See you next month on the fourth Thursday, which is April 22nd, 2021.